Woodbridge is the best town around. My name is John McCormick. I'm the mayor of this great town, and we're here today to show you why this is such a great town as we are at the annual health fair at the Woodbridge Health Center. I'm joined by Dennis Green, the health director. And today, Dennis, you have a whole host of people out here trying to improve the quality of life for our citizens.
Thank you, Mayor. It's a terrific event today, and we always hold the Mayor's Annual Health Fair on the third Saturday of October every year. We have it at the Woodbridge Public Health Center, which is located at 2 George Frederick Plaza, right between the Woodbridge High School and the Woodbridge Main Library. So what we do is every year we have everyone from the health department come here and participate over at this building. Everybody has tables, information. We invite local hospitals, local healthcare providers, pharmacists, the police department, recreation department, everybody who's involved in anything that's recreation, health, in any way. We invite them to come to our building, provide information and screenings. We also have hearing screenings, eye screenings, blood glucose screenings, blood pressure screenings. We also have flu shots today, so we have a host of things, a little bit for everybody, information, screenings, and we really try to make it a fun thing. So there's face painting, some other things. So every year it's a little bit different, and we have some great things. So we encourage everyone, if you couldn't make it here this year, to really try to make it every year. Like I said, it's the third Saturday in October every year.
And we have things for seniors and we have things for kids, so you have every generation covered.
Yeah, absolutely. We have face painting, we have the photo booth, we have some great little giveaways for kids and adults, always hand sanitizers, which everybody loves, but everybody who participates brings something for giveaways, so there's so much, and it's so much fun.
And the seniors here, we got all of our senior centers covered now with Hickory opening this week. We'll have 4 senior centers in 4 corners of the town. All those representatives are here. We're also talking about a plan to open up the senior centers, at least each of them one night a week, which I sprung on everybody last week and totally blew everybody away because I had not discussed that in advance with them. But that's the prerogative of the mayor. I get to do those things. But this is showing why it's great to be a senior in Woodbridge. It's great to be a resident of Woodbridge, because you come out to something like this and you just realize all the different services that are really available to you that you probably never even knew about. So Dennis is going to take you for a little walk around the each booth here and talk to each of the people. Let me see. Lizbeth DeJesus, our councilwoman's in the house. Come on in, Lizbeth.
Hi. Good morning. How are you?
What do you think so far?
I think this is an awesome event. I've seen so many people in here. It's hard to move through the hallways because it's crowded, which is a great testament to the fact that we get the word out that is needed. They're getting the information that they need. And because I'm the Hispanic representative of council, I'm so happy to see that a lot of the information is in English and Spanish. We're providing services. I walked in and one of my girlfriends walked in because she was getting the flu shot, because I think they're sold out everywhere or they don't have it, and we have it here at the health center. So we're providing services and we're meeting the needs of our residents, which I think is fantastic. It's something that you're passionate, at council we're passionate about. The work that we do is constantly with the thought, are we meeting the residents' needs? And I think that we do. And everything that we do, that's our first thought, and we're accomplishing, so congratulations. I think this is a great event every year. So if you miss it this year, don't worry, we'll have it again next year.
I have to correct something you said. You are the Hispanic representative of the council. You are a councilwoman who happens to be Hispanic.
Correct.
That's much better.
That's correct. Yep.
You are Hispanic. That's not why you're on the town council.
No, it's not.
You're on the council because of your outreach and because everybody knows you and knows your family.
Yes.
Your background's terrific. And by the way, you happen to be Hispanic.
I happen to be Hispanic. So, which is great because we are now representing part of our community that was not represented before.
That is very true.
Again, we're meeting the needs of our community, the needs of Woodbridge Township, trying to meet all of our residents' needs, not just one group, which is something that we work really hard at.
I'll go off script a little bit and say that what you've done with the residents of Caseby in particular, which is a whole giant neighborhood of people with very minimal English skills, and the way we've been able to go out there and have the pop-up library,
yes,
and have the mayor's breakfast, or have the parking with getting the permits, and the fact that you're there and can be there for the day and translate, that's invaluable to those people. They've never had that before.
I think it comes from, when I moved here, I was 9. We came from Puerto Rico, and we moved to the Bronx, not to Woodbridge, but my mom didn't speak any English. So I was the one always translating for her once I got hold of the language. And it's what happens in most of our communities where English is not the primary language. The kids always end up translating. So for me, it brings me back to those days where I was able to help my mom. And it's something that I'm proud of. I'm proud to speak two languages. And that's what we're supposed to do as public servants,
Right, exactly.
help everyone. So if I can use my Spanish to help our residents, I'm going to use it.
Well, now let's give Dennis the mic and ask him to go around. Just, give each
Thank you,
person
Mayor.
a chance
Thank you,
to talk
Councilwoman.
about what they provide and how they provide it, and get, names and then websites and phone numbers and addresses where people, if they're not here and they're watching on TV, can say, okay, that was there, great, let me call them. So give them all the contact information.
Absolutely.
And let's bring the health fair to them if they can't make it here.
Absolutely. Thank you, Mayor.
All right, thanks. We'll be back.
So we're here right now at the table of Danny from the Middlesex County Mosquito Commission. Now, Danny, you have some information on mosquitoes, correct?
Yes, I do.
Okay, so tell us a little bit about why mosquito control is important.
It helps prevent the spread of disease, keeps people safe from getting sick.
Okay. So there's a lot of diseases that we can get from mosquitoes. So how is the best thing? So we can prevent those diseases by preventing the mosquitoes from growing and breeding, right? So what's the best way to prevent mosquitoes from breeding?
The number one thing you can do is actually get rid of any standing water around your house, your property, buckets, containers, tires. Once you get rid of that, it goes a long way.
Right. So mosquitoes need standing water to breed, correct?
Correct.
Okay. So if they want to contact you, if they have mosquito problems, they think there are mosquitoes in their area, how's the best way to contact the Middlesex County Mosquito Commission?
You can actually go on the web and just in Google, put out Middlesex County Mosquito Commission, and our website will be right there. We'll have you can fill out a form for service requests. We'll come out and inspect and treat your house, your building.
Terrific. Thanks for coming today.
You're welcome. Thank you for having me.
Okay, and at this table, we're here with Skylar from the Society for the Prevention of Teen Suicide. Skylar, tell us a little bit about why you're here.
Okay, so the Society of Prevention of Teen Suicide is here to open up the discussion about mental health and suicide with the community. So what we really do is we're all high school students, and we go into our high schools and we talk to high school students about what's stressing them out, what is causing a lot of anxiety and issues with them, and we bring it back to adults and figure out what we can do to help.
Okay, great. So you think that students are more receptive to their peers when they talk about issues like suicide?
Oh, definitely. I feel like when it comes to adults, I feel like there's just a stigma or something, and they close up a little bit and they get really quiet about it. But I feel like if it's coming from a friend or someone your age, it's more relatable, so they're more willing to talk about it.
Terrific. So who are you here with today?
So these are other people on the council. This is Juliana, this is Jayla, and this is our other friend Josh.
Okay, terrific. So for people watching today, and if they want to reach out to you guys or get more information, how would they do that?
We are sptsusa.org, and we're all youth councils in our schools, so you can come with us there too.
Terrific. And you have a youth council, I believe?
Yes, so in our schools, we're all part of a youth council, and we talk to students and help that way.
Okay, terrific. Thanks for coming today.
Thank you so much.
Right now, wait a minute. Right now. What's happening?
Hey, Mayor.
So what's going on? You're still military, right?
Yes, sir.
How cool is that? First of all, she's here to play basketball, man. She is an amazing basketball player. I saw your dad last night at the Kennedy game.
You told me.
Yeah, all the time. What are you guys all doing here? I know you just interviewed him, but I didn't hear it.
We're the Society for the Prevention of Teen Suicide, so we're all in the high schools.
Wow.
Yeah.
That is so cool. I mean, Woodbridge had an incident, right?
Yep.
2 years ago.
That's
That
why
was
we're here.
awful, yeah. Wow, that's great. What do you do for that? How do you deal with it?
So we just talk to students, see what's stressing them out, what's giving them anxiety, what might cause them to think these thoughts. So we bring it back to adults to figure out ways we can help them.
How do you get trained to know how to do that, or do you just?
So we have a meeting once a month, and we talk about different ways to help. We're not qualified for that kind of stuff, so we bring it to adults. We have trusted adults, and we bring it to them. Trusted adults are people we can trust to do something about something that's happening.
So you kind of recognize the need and then turn it over to somebody who
Yep.
knows what. Oh man, that is so good. What made you do this?
I just like helping people.
Really?
Yeah.
Wow, congratulations. This
Thank
is
you.
cool. All right, keep going, Dennis.
Thank you.
So we're here at this table with Michelle from the Division of Addiction Services for Woodbridge Township. So Michelle, explain to us a little bit what you do and why you're here today.
Hi, my name's Michelle. I'm a recovery coach. I'm in recovery myself. I have 8 years in recovery. I'm here to encourage people to get clean and know that there's a better life out there. And we work for for the Blue Cares, it's a hotline, and we're recovery coaches on the other end of the hotline to help.
So recovery coaches do what? They respond to people who have some type of incident with opioids or overdoses, correct?
Mm-hmm. Yes.
So your goal is to help them find services, get them into treatment, whatever is going to help them get into recovery, correct?
Absolutely. We deal with the MAT, medication addiction treatment services. We deal with detoxes, rehabs, aftercares. We mentor them to about 8 to 12 weeks after that, and of course, years if they stay in recovery. We mentor them to be, we're here to get them help. And
so one of the important things about recovery coaches is that they've typically been through it,
yes.
right?
Mm-hmm. I've been through it. I've been in recovery. I've been in jail. So Blue Cares, they're the first ones on the response team. So we're working with them hand in hand, and they're calling us for overdoses.
So it's good that the people who are out there helping have been through it, have the experience, know what some of the hardest parts of getting through addiction is.
Addiction is a struggle. You're in the grip of addiction, and once you're in the grip, it's so hard to get out without help.
Okay. Now, if someone really wanted to get a hold of you or was watching this right now, how would they do that to get help? How would they contact you?
They would call me through the hotline, and I'm there to answer it and encourage them, and I will meet up with them and get them help.
How long have you been a coach? Sorry to interrupt your interview.
3. I've been
Second time he's done that in 3 interviews.
I've been here since Warm opened 3 years ago. I'm the original one. Yeah.
What's your name?
My name is Michelle Conway.
Oh, okay.
Yeah.
I remember that now. Say what WARM stands for.
Woodbridge Woodbridge Recovery.
The Addiction Recovery Mentors.
I'm a little nervous here.
Why, just because the mayor and the health
now
director are here?
You're doing really good.
I know. I got the camera on me.
But you guys do great.
Yes,
great
we
things.
do.
Our numbers are actually down.
Yeah.
Now, it just could be completely random, or it could be because you're really good at what you do. So you've been to the hospital, you've talked to people when they're at their worst.
I'm the one that wakes them up in the hospital to tell them what just happened to them in their lives, and I'm here to help you and guide you through this recovery. Yeah, it's an emotional journey. It's very heartbreaking, but yeah, hand in hand, I'm there to help them and guide them with whatever they need, and we're also here to help their families go through what they're going through with their families with addiction.
So Bonnie was getting an award one night by some group, and I was introduced her and presented her with the award, had to say a few words. And I said, we in public service, we try hard to change people's lives.
Yes.
You save people's lives.
Yes. And you know what? I've had people call me and tell me that I'm their angel.
Yeah, I believe it.
Yeah, it's great. It's a great feeling, and it's helping me in my recovery.
That's a big part of it, too.
So.
Well, congratulations.
Thank you.
You get a little choked up here. It's okay.
And thank you for all you do. You do a great job.
Thank you. I appreciate it.
Okay, and at this table, we're here with Diane from Senior Transportation of Woodbridge, or also known as STOW. Diane, tell us a little bit about why you're here and what information you have for the residents who visit our Health Expo.
Okay, so we provide free transportation to all the Woodbridge Township seniors, 60 or older. They can take our free transportation to the Woodbridge Community Center, any of the senior centers. We do medical appointments now, grocery shopping. So if they need to get somewhere, we can get them, and they can reach me at 732-726-2394.
Perfect. Thank you. Okay, and we moved on to another table, and Wegmans is here. Wegmans is actually a great partner for us at the health department. They always come to our Health Expo and provide us from some free samples of food and do the little preparation and show us how easy it is to eat healthy. So we're here with Nicole from Wegmans. Tell us a little bit about what you have today.
Good morning. So today we have our beet poke bowl. It contains brown rice and quinoa, radishes, macadamia nuts, red cabbage, beets, and red peppers with a beet poke sauce. This is a really great way to lower your blood pressure levels, and it's also great for inflammation, to keep down any types of inflammation you have throughout your body, your joints. And it's just a really great all-around fresh, hearty meal to have. And optional with zucchini noodles and arugula. And Melissa over here can also tell you a little bit more about it too.
Yes, the beet poke bowls are one of our popular bowls along with our salmon poke bowls. We do also offer the beet poke bowls over arugula and zucchini noodles as another healthy option instead of brown rice if you don't want all those carbs.
I tasted it, and it's actually very tasty, so thank you for coming today.
Yes, thank you for having us.
Thanks. Okay, and the next table we're at is with the senior center. So we have a number of senior centers in Woodbridge Township, and I'm here with Liz. Liz is going to tell us a little bit about some of the senior centers and about a new senior center that's opening up.
Hi, I'm Liz. So currently we have 3 senior centers. One is the Sycamore, which is located in Port Reading, 290 Old Road. The second is Evergreen, which is in Colonia, 400 Inman Avenue. The third is 5 Branches, which is located on 1 Brown Avenue in Island. And then shortly we will be having a 4th location, which is Hickory Senior Center, and it's going to be on 17 Coriel Street in Forts. Currently all 3 centers that are open provide classes as well as other activities for the 60-plus age group. The activities are helpful to keep seniors constantly engaging with one another, and we also offer seminars and things of that sort.
Okay, so terrific. Thanks for coming today, Liz. Liz, if someone wants to contact you and get more information about the senior centers, how would they do that?
So you could obviously drop by either of the senior centers that I just named, or you could reach out to the main line, which would probably be Evergreen because it is the original senior center, and you could reach 732-726-6261.
Great, thanks for coming. Okay, and we're here now with Michelle from Multi-Service Division of Aging. It's part of Woodbridge Township Health Department. Michelle, tell us a little bit about why you're here and what's going on.
Good morning, everyone. We are here because it is annual enrollment period for Medicare beneficiaries. You are more than welcome to call our office at 732-726-6262 to learn about the programs that we are having at all 4 senior center locations.
Okay, great. Thanks for coming today, Michelle.
Thank you so much.
So we moved on, and we're here with?
I'm Dr. Summer.
Okay, and Dr. Summer, why are you here today at the Health Expo?
I get invited to the Mayor's Health Expo to do free hearing screens for the community.
Okay, great. And obviously hearing screening is important. How long does it take to do the hearing screenings?
Oh, goodness. A hearing screen just takes a couple of seconds. I do an otoscopic exam. I look inside ears, just looking for wax, anything out of the ordinary. And then the hearing screen itself takes, about 30 seconds.
Okay, great. Thanks for coming. We appreciate it.
Thanks for inviting me.
Okay, now we're up in the back of the auditorium of the Public Health Center, and we're here with Tommy Lou from Hackensack Meridian. She's going to tell us a little bit about why she's here and why it's important.
Okay, well, Hackensack Meridian is here today to provide health screenings for the Mayor's Health event. And what we're offering today is bone screening, which is a screening test for osteoporosis. And then we're also offering blood screenings for blood sugar and blood cholesterol. We're also checking blood pressure and pulse. And we're doing what's called a stroke risk assessment by taking all the information that we've gathered from the patient and plotting it on a stroke risk scorecard so that we can let the person know what the risk of stroke might be.
Oh. Well, that's terrific. You guys obviously have a lot of people here helping you out today, so we really appreciate all the different screenings you do. Obviously, it's a nice variety of screenings, and these are very important. We appreciate you guys being a partner with us here at the Health Department.
Oh, thank you very much. We know it's important to be out in the community. Not everybody has access to maybe regular health care, and this is a great opportunity for people to be able to come and get, at no charge to them, have some screenings done. And then based on the information from that screening, we can recommend whether they should see a doctor or not.
Terrific. Now, Tommy, if someone wants to contact Hackensack Meridian or contact you for more information about these programs, how would they contact you?
Okay, all of our programs are listed on the Hackensack Meridian website, which is hackensackmeridian.org. You can look up at the different events or the different educational events that might be happening at the hospitals. They're all listed right there on the website.
Well, great. Thank you for coming today.
Okay, thank you very much.
I want to thank you for coming with us as we walk through the Mayor's Annual Health Expo. We weren't able to talk to every vendor here, but we have a great selection of different vendors providing terrific screenings and health information. Everything changes every year. We have a little bit different. So we encourage you to stop by next year when we have our next Health Expo on the third Saturday of every October. Thank you for coming. You can reach us at 732-855-0600, extension 5026, and thank you for watching.